Hey guys, so today we're going to talk about my experiences with endometriosis, adenomyosis, and ovarian cysts. I remember when I was 18, I was having really awful stomach pain. I was vomiting, I had diarrhea, and just stabbing pain in my pelvic region. And so I got really scared and I asked my brother, who was only 15 at the time. No, God, if I was 18, he was 13. um, if he would go with me, and he accompanied me to the emergency room, and thank goodness for him because he kept my spirits up. And we spent a couple hours there, did multiple testing. I mean, everything under the sun. And they came back and said, "We don't know what's wrong with you. Go home." And I was pretty devastated. And that was really what my life was like for a couple more years. It really kicked in probably a year and a half later. I started having those same symptoms on a regular basis, and I saw a lot of different doctors, and they told me it was food allergies and gastrointestinal issues and things like that. Sorry about the sirens in the background. um, they eventually uh, sent me to a gynecologist, and the gynecologist told me it was likely endometriosis and that the best thing to do was to be on birth control. And I had stopped taking birth control probably like 6 months. I was not using birth control, and that's when they really amped up my symptoms. And so I went back onto birth control. I got the IUD implant, and it was awful. It was so painful for me having the IUD. And I begged the doctors to take it back out, and the gynecologist kept saying, "Just give it more time, just give it more time, give it time to readjust." And so I did, and it was just, I wasn't even barely working because I was in so much pain all the time. I could hardly walk. And eventually, after 3 months, I said, "Absolutely not, take it out." And so he wasn't very happy about it, but he went back in and took it out, and he was surprised to find that it was crooked because it was being absorbed into my uterus. And at that point, I really knew without a doubt that this was endometriosis that I was dealing with. And so I said, "What do I do about this?" And he basically said, "There's nothing you can do. Take some ibuprofen, take B12, do exercises, use a heating pad, and hang out until you can get the surgery to remove some of the endometriosis or a complete hysterectomy." So then it became my mission to get a complete hysterectomy. And you may have watched my other videos. I eventually did get the complete hysterectomy with oophorectomy. But yeah, I fought for that for years. And when I was 23, was when I first got my ovarian cyst. So I was having my typical endometriosis symptoms, which usually included a lot of abdominal pelvic pain, a lot of gastro upset. That would really just take me out. I mean, a ton of fatigue, a ton of pain. I was mostly bedbound when I was having symptoms, and this would last for hours. The only thing that helped was B12 and a heating pad. and that barely did the trick. And so one day I was having these symptoms, but they were really escalated. They were really, really bad. And then I was in the bathroom, doubled up on the toilet. I had pretty much stripped all my clothes off because I was pouring sweat and I was shaking so bad, and my whole body hurt because I was shaking so vigorously. And I was terrified. I was in so much pain, and I had diarrhea, and I was basically stuck on the toilet with that until my body had nothing else to get rid of, and it felt like I was pushing my insides out. It was really, really awful. My body just kept clenching and nothing could come out because there was nothing left. And I had vomited a few times into the trash can because I was stuck on the toilet, and I was so scared. And so I called my husband, who was at work, just bawling. I said something's wrong, and he came home, took me to the hospital. And at first they were like, it's probably nothing. You're probably having a food allergy. And after testing and the ultrasound, they found that I had an ovarian cyst, and it was putting pressure on my colon and my intestines and causing the upset. And I was like relieved and scared at the same time. It was like all I knew of ovarian cyst at that time was that it was a cyst, and a cyst to me back then was like cancer, benign or malignant. Like, it was bad. And so I was like, okay, well, what do we do? Like, can you remove it? And they were like, no, we can't do that with this. So you just have to wait, and hopefully it won't rupture. And so go home and take some ibuprofen and B12 and use your heating pad and hang in there. And if you have bleeding or more significant pain, come back, because it probably ruptured, and then you're going to have serious problems. So I had to go home, and luckily it did not rupture, but I went to the ER 2 more times after that in my lifetime for ovarian cyst. They had found one on the same ovary in a different spot later, and that one was reoccurrent. It would just deflate and fill back up, and it would fill back up during my ovulation period until that one ruptured. And I knew when it ruptured because I had this huge blood clot come out, and it was really painful and terrible, but I didn't have any additional bleeding, and I wasn't bleeding internally, so we just left things alone again. And then after my hysterectomy, my doctor told me that yes, for sure, it was endometriosis. And it was like, I knew it. I told you so. But that's when he also let me know that there was adenomyosis, and of course, there was the ovarian cysts, which they weren't swollen into cysts at the time of surgery, but he could see the pockets where they were reoccurring. But the adenomyosis and endometriosis were some of the worst he's ever seen, and it was so bad that it had fused my uterus to my perineum. And so that explained a lot too, because a lot of my symptoms were that I had really painful bowel movements, which seemed really weird to me because I didn't have that like my whole life. And then suddenly, as an adult, I'm having every bowel movement is really, really painful. But now I know that my uterus was fused to my perineum, and so every time that area, those muscles contracted, it was putting pressure on a lot of things down there, including my uterus. So, yeah, that explained a lot for me. And after the surgery, my symptoms were significantly changed, and now, um, more than a year after my second laparoscopy, I have not had issues. Knock on wood up there. I'm still having pelvic pain, but like nothing like I used to have. I mean, from the time that I was 18 until I was 31, I had this pain in my life, and it is the reason why I decided to get the hysterectomy. So you can watch that video if you want. But I really just wanted to talk about what my experiences were, what my symptoms were. And so, yeah, for me, it was a lot of pain, horrible stabbing pain. I had pain with intercourse. I still have intercourse pain. It's not as bad as it used to be. I had really painful bowel movements. I got a lot of bladder, urinary tract infections. And I had migraines that they said were menstrual migraines, but I still get migraines, so that's punchable. But yeah, so for 3 weeks out of every month, I was not doing great because my ovulation period was when I would get the cysts. The premenstrual period would be the endometrial pain and the common symptoms of PMS. And then the week of my period was always awful. For 3 out of the 7 days, I would have my period, sometimes 4, and those days were really painful. And I would feel better after I stopped bleeding for like 3 days. And then I used the Nuva ring at the time, so I'd put my ring back in. And then for a week I was doing okay, and then the whole cycle would start all over again. So for more than a decade, I dealt with that pain, and it was pretty horrible. And I'm so glad I don't have to live like that anymore. It's just a miracle, I'm telling you. And that's not to say that the hysterectomy is a cure for this disorder, because it's absolutely not. And I'm proof of that because I had to have a second laparoscopic surgery, and I might have to have another one in the future. You don't know. It's endometriosis can come back. But even just living for a couple months without it is just life-changing. So if you have any questions for me, feel free to ask in the comments, and I'll be sure to answer you, because I definitely want to share my experiences with everybody, and let you know that you're not alone with what you're going through, and there is help. And I'm so glad that now you guys have medications like Larissa, I think it's called, medications for endometriosis, because I didn't have that back then. And I'm so glad you guys have that now, because there needs to be an answer for this. There needs to be help for this. So many women suffer from endometriosis and ovarian cysts and other gynecological disorders and period pains. So it's just not worth it, and it's not okay. And I'm so glad that we're on the brink of finding help for this. And hopefully the future will mean that other women don't have to suffer in the ways that I did, or they won't have to. They'll have other answers than getting a complete hysterectomy to solve their pain. So yeah, if you have any questions, feel free to ask, and I hope this helped you. Have a great day, guys. See you next time.